Michelle Alanis here, and today we're going to be talking about assessing sensory integration. If you're interested, I have a checklist that I use that I take in when I do an evaluation just to make sure that I don't forget anything. And I can just fill it out very quickly as I'm doing my clinical observations. So my email address is in the notes for this episode, and you can check that out and send me an email if you want the checklist. Today, we're going to be talking about the vestibular system. Now, when I assess SI in a client, I first look at modulation skills and then I follow that by looking at discrimination skills. Let's talk about modulation in vestibular processing. The first thing I want to know is how is the child responding to movement in their environment? How are they responding to gravity and imposed movement versus self-imposed movement? And so I look and just watch them while they play. Do they actively go and play where their feet are coming off the ground, like they're climbing the mountain, or they're going up the stairs and jumping into the ball pit? Or do they tend to want to stay planted onto the mats? I ask the parents, when you pick up your child suddenly, is that distressing to them or are they comfortable with that? I look to see what's the child's response to having their head tipped backwards. Oftentimes, I'll put them on a therapy ball and I'll test their writing reactions while they're on there. And then I'll also push them so that they go backwards onto their back and see what their reaction is to that. Sometimes kids think it's hilarious and they want to do it over and over again and they throw themselves backwards. And other times they're really scared and nervous about that. And they'll tense up and they'll do everything they can to keep their head tucked in so that they don't tip their head backwards. And then I also watch to see what are their preferences in play. Are they seeking out vestibular input or are they avoiding it? And then finally, I read their PRN, their post-rotary nystagmus. That's a reflex that we can see in the eyes after rotation. And if you're interested in measuring that, I have a separate video that shows a demonstration of that and walks you through all of the key elements that you need to keep in mind if you are going to try to measure the PRN. So now what does all of these things tell? What do all of these things tell us? Again, we're looking at vestibular modulation. So we want to know, does the child have a high threshold, meaning that it takes a lot of input for that vestibular system to register that something's happening and have a reaction? Or do they have a low threshold, which would mean that it takes just a tiny little bit of input and then the child may become overwhelmed with the input? Or are they modulating it just fine? So when we're looking at their response with their feet off the ground, we're looking to see, is this child maybe a little bit gravitationally insecure, which would be a low threshold typically. So they feel like they want to stay as close to the ground as possible because that's where they feel secure. And then when they're moving through space and they're going up and up, that's hard for them. These kids are oftentimes afraid of escalators and elevators as well. Or is it a child, when we're looking at the head tipped backwards, do they kind of lose where they are in space with that? Or are they able to quickly make adjustments and understand how their body is relating to gravity and where their head is in relation to gravity? We're looking to see, are they seeking out a lot of input? Can they spin, 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 and never have a dizzy response? Or are they avoiding it because it feels uncomfortable to them? One of the things that can be tricky about this is that sometimes a child will avoid swinging, avoid the swings completely. And you may think, aha, this child is, gravitationally insecure. They're sensitive to sensory input. But what we may find if we spend more time with them is that actually they're just really controlling about their environment and they like to be in full control of where their body, what their body is doing. And so getting onto a swing where they lose control has an uncomfortable sensation for them that has nothing to do with the sensory input, but has everything to do with their sense of control. So I also just like to see if I can entice a child over onto a swing, if I hang it very low to the ground and they can easily climb on and off of it or control it with their feet, or if I can pick them up and move them around and they're okay with that, but not because they're used to it with their parents being picked up and moved around, or if they consistently respond, even in familiar and safe environments where they don't want to have that movement. Another question I'll ask if they're younger children is I'll ask the parents, how do they respond when you put them up on a changing table? Are they comfortable in that elevated position? And when you tip them backwards to change their diaper, does that seem to be distressing to them, or are they comfortable with that when you're doing that? So those are a few tips for evaluating modulation in the vestibular system. And again, check out the PRN video if you want to know more about how to measure that and why we measure it and what we look for with that. And stay tuned. Next, we'll be talking about vestibular discrimination skills and how to assess those. Thanks. Happy treating. Bye.